I think, first of all, I thought the interview was going to be in Hindi or Gujarati.
Okay.
So I was going to say, Mujhe Hindi nahi aate. Tulsi Bhai, I like the name because the plant is a medicinal plant. By the way, I just planted Tulsi Bhai here in the wellness center, and I'm really happy to do that because it has many benefits to take care of our forest and to contribute to make sure that our world is green. So I don't see it only as medicinal, but I think given the climate change we're witnessing now, planting trees is very important. So I'm really glad to be part of that. So I'm happy to be called Tulsi Bhai, given the prominence of the plant itself.
Absolutely. Traditionally in India, it's also called the protector of our household. Every Indian household has a Tulsi. So just want to ask you, what has been your observation? You've just visited a sub-healthcare center in Adraj in Gujarat.
Yeah.
What's been your observation?
From the start, when this was announced by the government some years ago, the Ayushman Bharat initiative, WHO supportive, because we believe that primary health care, the countries should invest in primary health care. That's what we have been telling countries, and India is actually doing that. And for any health system, a strong primary health care is key, because most of the services can be provided at primary health care level, more than 80%. And not only that, outbreaks can be prevented at primary health care and can be detected early at primary health care level. So the investment in primary health care in Ayushman Bharat by the government of India is the right investment, and that's what we're asking all countries to really focus. As you know, many countries, including high-income countries, were surprised by COVID. The problem was because of lack of investment in primary health care. So when I say investment in primary health care, it's for all countries, whether it's high income, middle income, or low income. So this is the right investment. I have been talking about Ayushman Bharat and commending the initiative, but I'm glad that I have visited today, one of which, and see firsthand how it functions. And including, by the way, telemedicine. There was consultation with a doctor remote 40 kilometers from here. And I'm really happy that not only services provided here, but patients, instead of traveling to far places and spending on transport fees and so on, they can get additional services remotely from here. And that's what we have witnessed, one person getting the benefit of the telemedicine. So I'm glad to witness firsthand how the Ayushman Bharat is doing. Of course, there are more than 150,000 across the country. And I hope the government will continue to invest in this.
How do you see India COVID and vaccination journey?
Of course, we are now, COVID is behind us, and India did its best. Yeah.
So what about the EG.5 variant that has been called the variant of interest now, the EG.5? There's a new variant in circulation. What is the WHO's current assessment on that?
So on new variants, not only EG.5, we would expect more variants to emerge. What's important is to really continue to do our tests. I mean, we continue to be vigilant, because many countries are not testing enough. And we wouldn't know whether the virus is changing or not. So from the EG.5, what we can say is new variants may emerge, and continuing to test will be very important, and see how the virus is behaving. But we're following this particular variant, and we will do everything, not only on this variant, but any emerging variant. But countries should be continue to be vigilant.